Thank you very much, Jocelyn. And this morning, in the morning session, people were asked to talk about why it mattered to them. And I just want to start with saying that I am a fourth generation farmer. My sisters and I are still farming, and everything about the way that we grew up and lived was actually rooted in a robust experience of democracy, because whether or not we had electricity or roads or a bus to school or created a grain co-op, and all of those things were decided in our community through conversations that happened in our yards and at meetings. And I just grew up thinking that was what was normal, and that everybody had that experience of sort of this participatory decision-making process. And I brought that with me into the field of public health, where I worked in providing services and professional continuing education for about 15 to 20 years before I began to ask why we weren't able to build the public and political will for the decisions that would make us healthy. And that led me to a very intentional process about 15 years ago of trying to understand how we build power and what we need to do. And I ended up working at this intersection between community organizing and public health to begin to understand better what we can and need to do. That led me into governmental public health and political appointments as the director of the, I was the assistant commissioner for health in the Minnesota Department of Health and chief health equity strategist, and then the state health officer in Wisconsin. But for the last year, I've been working at this intersection of voting and health and civic participation. Next slide, please. The Healthy Democracy, Healthy People Initiative is actually a nonpartisan coalition of 10 national public health organizations that are working to advance health equity by assuring access to the ballot is available for everyone. And I'm going to be coming back to this idea of organizing organizations and organizing our relationships. But this is important distinction here. All of these organizations, or most of these organizations, have a base. They have people that they are also organizing. So this is an organization of organizations, so I want to highlight that because we're going to be coming back to that. Next slide. I think it's important when we think about health equity and public health to recognize that we're talking about health broadly, and that public health is what we do collectively to assure the conditions in which all people can be healthy. And it isn't just about programs and services and monitoring diseases and all of the things that are most clearly connected. It is actually this understanding of having to collectively assure the conditions. And next slide. So in my own sort of learning and practice, it was very clear that initially we've been thinking about health outcomes as like the focus, and then what can we do to impact health outcomes? And then public health as a whole began to say, well, we have to do focus on living conditions, and the thing that was really missing was this understanding that we have to build our collective power to influence those conditions. Next slide. There are 3 practices that we can use to build conditions or to build our strength and power. They are organizing people and strengthening the capacity of communities, organizing the narrative knowledge and data, and organizing the resources and how policies and practices work. And this is just really, if we use those practices across all of our work, we are working to build collective power. Next slide. The tools we have in the field of public health and in many of our jobs we have research, data collection, health assessments, reports, policy at all different levels. We have our grant making and our resource allocations and our budgeting. Very important, our relationship building, the convening processes, and aligning our actions with what we know creates health. Next slide. And the civic health infrastructure of our everyday lives really then includes the, let's see, these are the things that we're doing as a collective, where we did a letter to the Biden administration to reincorporate the Healthy People 2030 objectives around voting. Health and Democracy Scorecard that Dawn spoke about earlier today, and some upcoming initiatives that are going forward. The next slide is just a quick summary of the information on the Health and Democracy Scorecard that we'll be releasing at the end of the month. And then finally, a call to, next slide, a call to action for all of us. And we'll have a chance to talk more about some of these specifics during our question time. Thank you.